Hi, it's Derek here at Midlands Physical Therapy. Now, I recently wrote a blog titled Why Runners Get Knee Pain, and what I want to do in this video is to discuss some of the key points that I wrote about in the blog and just explain them a little bit better on this video. Now, you'll hear an awful lot of runners who get knee pain that have gone to clinics or that have looked up things on the internet, and they come back with things like they've got runner's knee, they've got ITB syndrome, they've got patellofemoral syndrome, tendinosis of the patellar tendon, different things like that. And they might try orthotics, they might try exercises, they might try massage, all different things that basically just treat the symptom, which is the pain, but don't really get to the true cause. And what I want to do in this video is talk about one of the big reasons that cause all of these things around the knee and what can be done to help that for runners specifically. Now, I'm going to bring your attention to this graph, and basically, I hope you can see this. What I have is I have two graphs here. So I have an ideal situation here when a runner's foot hits the floor. So this is their back, this is their hip, this is their knee, and this is their foot. So when their foot hits the floor, all of these muscles want to be equally absorbing some of the force that goes up from the foot up to the hip. So the calf takes 25% of the load, quads take 25, hamstring takes 25, and the glutes take 25 up here. Now, in someone who has knee pain, what I often see is a situation something similar to this, where they can't absorb weight through their calf effectively. Their hamstring is not going to work effectively either, because the calf comes up and intersects with the hamstring, and that has to distribute the force up towards the glute, and the glute is not going to be working effectively either. So that means the quad is left to take up a lot of the imbalances that are involved, and that will end up doing something similar like 85% of the workload. Your quads come down here, they insert over your kneecap, and they're going to put extra pressure through your kneecap, and over time, if you're running a lot of miles, your knee is going to get irritated. All the tissues around the knee can get irritated, and that can lead to a lot of problems like that. So it's similar to this position here. So when your foot hits the floor, when you're running, calf 25, quad 25, hammy 25, and then up into your glute doing 25. Now, what often happens, and I'll draw one more graph here, is that people can go and they can get orthotics, or they can go for dry needling, or they can go for a deep tissue massage, something like that. And they might feel great afterwards, and they might think, okay, I'm fixed, I'm ready to go back running, but there may still be an imbalance present like this. So you can see that the calf is doing 10, hammy is doing 10, glute is doing 10, so that means the quad still has to do 70% of the work. And if someone goes off running in this situation where they feel good, but the quad is still doing 70% of the work, they may feel fine for a couple of miles or a couple of kilometers, and then after a while, the body will get, the quads will get tired, will get irritated, and they'll revert back to their old pattern, which is this type of a situation here, and they're going to get that pain again. So that often happens when people get treated. They feel great, they think they have no pain, they go back, and then the problem returns. So that's why knee problems can keep on coming back, even though people think that they have gone for treatments that have helped. So to get back to that ideal situation where all of those muscles are doing 25, 25, 25, and 25, obviously the quads have to be treated. The workload has to be taken off them. But a big thing that I do in my clinic, and that I find works very, very well, and this has also worked in physios that do this in professional sport, is that you need to get the calf and the hamstring working well here isometrically. So when the foot hits the floor, they need to be able to contract well together to put the force up to the glute, and that means that you can push off onto the next step. And it means that the quad does not excessively have to take a lot of the load. Now, the second thing that I see as well is if those guys, if your calf and your hamstring are not able to contract together efficiently when your foot hits the floor, you'll often see that the knee will sink a little bit too much like this. And you can see that on runners when they run, their knees will sort of sink like this, and they won't have that stiffness in the joint. Now if your knee is sinking excessively like this, your quad has to work harder to push you onto the next step. And what will happen there is your quad is going to tire out, it's going to get fatigued. Again, your quads come down over your kneecap into your tibia. If they're getting tired, if they're working harder than they should be, you're going to get irritation around the knee joint again. Okay, so it's very important when your foot hits the floor that you have that stiffness between the calf and the hamstring that travels up to the glute, that it's able to push you off to the next step, and you have what I call elastic energy. So you're very efficient with your energy, you're not wasting energy excessively, and when we get these guys firing well together, you can often feel like you have way more energy left at the end of a run, you're way more efficient, you don't feel as fatigued, and you're just a more efficient runner. You have to do less to get further. Okay, so I hope that makes sense. If you have any questions, please get in touch with the clinic here in Mode, or else you can check out my website. It's midlandsphysicaltherapy.ie, and I'll be putting up more videos like this very soon.